We're here outside the Cape Town International Convention Centre, and we're here for the International Society for the Prevention of Pneumococcal Disease 13th annual meeting. We're going to go inside in a minute, and we're going to have a session where scientists and policymakers and advocates look at the science that's being considered at this meeting.
We're here to talk about how we improve adult pneumococcal vaccination policies and programs to really unlock its full potential.
There is a view that policymakers do take a narrow view, and there may be reasons to do that. One is it's probably easier for them to take a narrow view because it probably guides how they would implement a program. I think everyone in the room would appreciate that vaccination in adults is probably under-recognized, utilized in terms of a practice. And I think two is the issue of recognizing which adults are at risk for these vaccine-preventable diseases.
Politicians are thinking to the next election. That's understood. And the reason they're thinking to the next election is because if they want to implement a long-term view, you've got to get elected. So I think that what we have to keep in mind is that the particular long-term perspective is important, but we can't miss that short-term win. And often those wins are about investment, so about outputs rather than outcomes.
The two most cost-effective adult vaccines on one measurement are flu and pneumococcal, but the uptake of pneumococcal is much lower. So why do you think that is?
We know that knowledge is a key driver for vaccination, and of course, when people aren't aware of that a vaccine exists, they won't get it.
There still is this perception that many of the vaccines are for children and not for older adults. You know, there's been a good, in some ways, success story that rates of pneumococcal disease have declined a lot, through herd immunity and through increased vaccination of children, but there still is a remaining disease for older adults. If you made it easy for them to get the vaccine, if they didn't have to worry about transportation, and particularly when you're talking older adults who may have mobility issues.
Who is it who can actually make the politician look at all the affected groups Lois was talking about there, the children, the economic impact, and turn it into a political imperative?
It's one of those things where we need to have as many people, as Lois mentioned, at the table. So recognizing it's not just one group or one advocacy campaign working towards it, but actually it's lots and lots of different people saying the same thing, that, adult immunization, life course immunization is important. So then we realize that, again, as Lois is saying, it's not just a health issue, it's an economic issue. So one of the key things that we're doing with our index is trying to demonstrate that very clear economic case for investing in immunization.
We often forget when we have these conversations that we need social scientists in the room, political scientists in the room, so to help frame some of the messaging that we need.
Anybody who's working in a cabinet, working in finance area, the heads of government, they're all interested in improved productivity. And it's one of the really strong arguments that we have with regard to immunisation. The pincer movement is really important. So a lobbyist who's doing their work in advocacy has already spoken to the appropriate senior civil servant before they come into the minister, and probably have spoken to the minister's advisors. But they've also, in the past, done work to ensure that the political party is also on side, or certainly is not objecting.
3 minutes we have left. I'm going to ask each of you for about 30 seconds, if I may, on this. If preventative health spending increases by just 0.1 percentage points, I think that's 0.1% of GDP, isn't it? It can unlock a 9% increase in annual spending by people aged 60 plus, and an additional 10 hours of volunteering.
The point with that said is really to show that it doesn't need to be huge increases in preventive spend that can result in an improvement in the economy.
What can we do to structure political rewards today, those outputs you were talking about earlier, Michael, that might make it easier for politicians who want to do the right thing, who want to be the visionary?
Recognise when they do something that's really good.
Yeah, I think I'm going to reemphasize the point around the data. So having that data easily accessible, one place that can, that people can really easily understand. And then I think also having that data on specific groups. So we know, for instance, in some countries there are huge inequalities in uptake on lines of income, ethnic minorities. We're looking at 20 percentage point difference. So having more of that data to really be able to understand who it is that we need to target is going to be vital. And we don't have enough of that yet. So that's going to be really important, I think, in terms of getting those messages across.
It's important that you're customizing your message to your audience and what they really care about. The way that I would close it up is to know who you're speaking to.